save lives. My mission is to empower you with information that can make a real difference in the world. Welcome to today's video, where we'll be delving into febrile seizures, a condition that impacts many children. Febrile seizures can be a distressing experience for parents and caregivers, and having a clear understanding of what they entail and how to respond is of paramount importance. These seizures are more common than you might think, affecting many families around the world. Whether you're a concerned parent, a caregiver, or simply curious about this topic, stay tuned as we explore essential information and guidelines surrounding febrile seizures in today's video. A febrile seizure is an episode of convulsions that can occur in certain children when they have a high body temperature, also known as a fever. Fortunately, most children who experience these seizures recover fully without any lasting harm. The primary course of action involves addressing the underlying illness responsible for the fever. What causes a febrile seizure? A febrile seizure is also referred to as a febrile convulsion. It can be provoked by any medical condition that results in an elevated body temperature, commonly known as a fever. Febrile seizures most frequently occur in conjunction with ordinary illnesses such as ear infections, tonsillitis, colds, the flu, urinary tract infection, and various viral infections. It's important to note that severe infections like pneumonia, kidney infections, and meningitis are far less common culprits for febrile seizures. Who experiences febrile seizures? Febrile seizures are observed in approximately 2 to 5 out of every 100 children at some point before the age of 6. These incidents tend to be most prevalent between the ages of 12 months and 18 months, while they are quite rare among children under 3 months old and those older than 6 years. Several factors can contribute to a child's susceptibility to febrile seizures. Previous febrile seizures. Children who have experienced one febrile seizure are at a higher risk, with about 3 to 5 out of 10 of them potentially having another one. Family history. A family history of febrile seizures or epilepsy increases the likelihood of a child experiencing febrile seizures. Neurological conditions. Children with neurological conditions, such as cerebral palsy, have an elevated risk of febrile seizures. Premature birth. Febrile seizures appear to be more common among children born prematurely. Maternal smoking. The risk may also be heightened for children whose mothers smoked around the time of their birth. Febrile seizures often occur when a child's body temperature rises above 38 degrees Celsius. Approximately 82 out of every 100 febrile seizures are attributed to viral illnesses, with common culprits including the influenza virus, rhinoviruses, and enteroviruses. About 11 out of every 100 febrile seizures occur within 2 weeks of a vaccination. It's essential to note that fevers are a common side effect of vaccines in children. Nevertheless, the benefits of vaccination, protecting against serious illnesses that can also lead to fever and febrile seizures, far outweigh any potential risks. Therefore, children prone to febrile seizures should continue to receive their vaccinations as recommended. It is advisable to take paracetamol regularly after the vaccine for 48 hours to prevent fevers. Symptoms of febrile seizures. Febrile seizures can be categorized into 3 distinct types, each with its own set of characteristics. 1. Simple febrile seizure. These are the most common, accounting for approximately 15 out of 20 cases. They typically occur early in the course of the illness when the child's body temperature is on the rise. Symptoms include: the child may appear hot and flushed. Their eyes may seem to roll backward, and they may appear dazed. The body can become rigid and experience twitching or convulsions. The child may lose consciousness and become unresponsive. Some children may involuntarily urinate during the febrile seizure. Simple febrile seizures are usually brief, often lasting only a few seconds, and it's unusual for them to extend beyond 5 minutes. Afterward, the child may exhibit drowsiness for a short period. Typically, within an hour or so, the child's condition improves as their body temperature normalizes. An essential characteristic of a simple febrile seizure is that it does not reoccur within 24 hours. 2. Complex febrile seizure. This type is less common, occurring in around 4 out of 20 cases. It shares similarities with simple febrile seizures but may display one or more of the following features. The seizure lasts for more than 15 minutes. The seizure recurs within 24 hours. The child does not fully recover within 1 hour. This doesn't mean the seizure itself lasts more than an hour, but that it takes over an hour for the child to return to their usual state. The seizure exhibits focal, formerly known as partial, features. This means that instead of generalized twitching or shaking, only a specific part of the body may be involved, such as one arm or one leg. 3. Febrile status epilepticus. This is a rare occurrence, happening in less than 1 out of 20 cases, and is characterized by a febrile seizure that endures for more than 30 minutes. It's crucial for parents and caregivers to be aware of these distinctions in febrile seizures to better understand and respond to these episodes in children. First aid for febrile seizures. Note the time. Start by noting the time when the seizure begins. This information will be helpful for medical professionals. Cushion the head. Gently cushion the child's head using your hands or soft materials to prevent injury. Ensure safety. Ensure that there are no objects or hazards nearby that could cause harm to the child during the seizure. If necessary, move the child away from potential dangers. Do not restrict or put anything in the mouth. Avoid putting anything in the child's mouth or attempting to restrain them. It's essential not to interfere with their movements. Recovery position. After the seizure has ended, place the child in the recovery position. This position helps keep their airway clear and reduces the risk of choking. Lower the temperature. If the room is warm, you can help lower the child's temperature by removing their clothing. This should be done once the seizure is over and the child is safe. Hydration and medication. Once the child is alert enough to swallow, offer them a drink and consider providing paracetamol or ibuprofen to make them more comfortable. Always follow appropriate dosing instructions. What to do after immediate first aid. Call an ambulance if the seizure continues for more than 5 minutes, including small twitching movements. Even if large jerking movements have stopped, call for immediate medical assistance. When to seek medical attention. Seek urgent medical attention under the following circumstances. This is the child's first febrile seizure. The child is younger than 18 months old. The child does not show rapid improvement after a brief seizure. Another seizure occurs shortly after the first one ends. During the seizure, there are focal signs, e.g., only one arm or leg jerking instead of the whole body. The child experiences difficulty breathing. The child was not fully conscious before the seizure or remains altered for more than an hour afterward. The child has recently taken antibiotics, which could mask symptoms of a more serious infection like meningitis. You are concerned that the child may have a severe underlying illness, such as meningitis, causing the high fever. If the febrile seizure subsides within 5 minutes, there is typically no need for specific treatment targeting the seizure itself. Instead, the focus should shift to addressing the infection responsible for the fever. Notably, the majority of febrile seizures, about 82%, result from viral infections, which generally do not require specific treatment. In cases where the seizure persists for more than 5 minutes, it is crucial to call for emergency assistance by contacting an ambulance. A healthcare professional may administer medication to terminate the seizure. Examples of such medications include diazepam, which can be administered rectally via the child's back passage, or midazolam, which can be administered into the side of the mouth. These medications are rapidly absorbed directly into the bloodstream from either the rectum or mouth, effectively halting the seizure. In some instances, parents of children prone to recurrent febrile seizures are educated on how to use these medications and provided with a supply to have on hand in case of further febrile seizures. It is essential to investigate the source of the fever that triggered the febrile seizure. In many cases, the cause is evident, such as when the child exhibits symptoms of a cold, flu, or is known to have an ear infection or urinary tract infection. However, when the cause is not readily apparent, a thorough evaluation should be conducted in the emergency department. This evaluation may encompass blood tests or X-rays, although these are not routinely recommended for febrile seizures as they are unlikely to alter the management. While meningitis is a relatively uncommon cause of febrile seizures, given that febrile seizures are common and meningitis is not, it is important to rule it out, especially when the cause of the fever remains unclear. Notably, 1 in 4 children with meningitis will experience a febrile seizure at the onset of the illness, highlighting the importance of excluding this possibility in cases with ambiguous causes. In such situations, a lumbar puncture may be recommended, a procedure involving the removal and testing of spinal fluid. A lumbar puncture may be suggested if a healthcare professional observes signs indicative of meningitis. The child is aged between 6 and 18 months and has not received the HIV vaccine, which provides protection against meningitis. The child experiences febrile status epilepticus. A child under 12 months of age has a complex febrile seizure. Evaluating and addressing the root cause of the fever is paramount for ensuring the child's well-being and determining appropriate medical interventions when necessary. Are febrile seizures dangerous? Generally, febrile seizures, while certainly alarming, are not typically considered dangerous. Most children who experience a febrile seizure make a full recovery. Moreover, the underlying illnesses that trigger febrile seizures are often common respiratory infections, such as colds and viral infections, which are usually not serious. Can febrile seizures be prevented? While it might seem logical that reducing a child's body temperature during a fever could prevent febrile seizures, there is limited scientific evidence to support this notion. However, when a child has a fever, it can lead to discomfort and irritability. Here are some measures that can be taken to help lower the child's temperature and make them feel more comfortable. Use paracetamol and/or ibuprofen. Administer paracetamol or ibuprofen if the child is over 6 months old, to lower the fever. It's important to note that the fever may return as the medication wears off. Adjust clothing, keep the child lightly dressed, or remove their clothing if the room is warm. This helps regulate their body temperature. Stay hydrated. Encourage the child to drink plenty of cool fluids to prevent dehydration. Will febrile seizures recur? In most cases, only one febrile seizure occurs. However, in 3 to 5 out of 10 children, a second seizure may happen during a subsequent feverish illness. The likelihood of a future febrile seizure is increased if the initial one occurred in a child younger than 15 months or if there is a family history of febrile seizures among close relatives, such as parents, siblings. Does a febrile seizure cause permanent damage? Generally, febrile seizures do not result in any permanent damage, and most children fully recover with no lasting effects. A study following children who experienced febrile seizures even found that these children performed at least as well, if not better, than those without febrile seizures in terms of intelligence, academic achievement, behavior, and working memory. Is a febrile seizure a form of epilepsy? No, a febrile seizure is not a form of epilepsy. These are two distinct conditions. Febrile seizures, these are associated with feverish illnesses and are not caused by epilepsy or any underlying brain abnormality. They occur due to the elevated body temperature during a fever. Epilepsy leads to seizures without an accompanying high temperature, fever. It is a separate condition characterized by recurrent, unprovoked seizures. I will do a separate video about this in the future, so make sure you are subscribed and have the notifications on so you don't miss it. While it's uncommon, approximately 2 out of 100 children who experience a febrile seizure may develop epilepsy in later childhood. This slightly increased risk is thought to be associated with certain individuals who may be predisposed to both febrile seizures and epilepsy. It's important to note that the febrile seizure itself does not cause epilepsy. Rather, a child who is destined to develop epilepsy may be more prone to experiencing febrile seizures. Recent research also suggests that children with febrile seizures may exhibit differences in genes related to fever response, as well as variations in several genes affecting brain cell responses, including some genes commonly found in people with epilepsy. Conclusion: febrile seizures are typically not dangerous and often resolve without any lasting consequences. Most children who experience them recover fully. It is reassuring to know that, in many cases, these seizures do not recur. However, being prepared and informed is key, especially for parents of children who may be prone to febrile seizures. Remember that swift action and appropriate measures can help mitigate risks, and understanding the difference between febrile seizures and epilepsy is essential. And that's it, guys. We have covered a lot of useful information today. I hope that this information will be a helpful resource for either you or someone you love. As a full-time doctor, my goal with this channel is to share my medical knowledge with all of you to help improve your overall health and well-being. If you found this video useful, please consider subscribing for more helpful content just like this. I'll be publishing a new video every week, so if you have any suggestions for future topics, please leave a comment below. Until then, take care of yourselves and stay healthy.